New at 9, Parkside Psychiatric Hospital and Clinic is taking a big step in pediatric psychiatry by working to increase the amount of qualified professionals that can serve the children of Oklahoma. And that initiative is already underway. I spoke with their medical director of education today on how they're making it happen and how it will get more help, more places.
What we're finding over time is that there's just not enough of us.
Dr. Matthew Sharp is a pediatric psychiatrist and the medical director of education at Parkside. He treats members of the community through these doors every day.
The reality is there's very few doctors like me, and we retire more than we generate every year.
Dr. Sharp says there's been a shortage of professionals in the state to meet the needs of the community. And to combat that, they've implemented a dedicated teaching and training floor with help from the Future of Medicine.
We'll be getting medical students from both OSU's medical school here in town, as well as the community medicine program at OU at the Schusterman Center.
Dr. Sharp's training will range from medical students to fellows and even pediatrics, so that even if the program doesn't generate all psychiatrists,
generate more adult psychiatrists and enough pediatricians that feel more comfortable with it to give them a greater grasp and a bigger net of treatment before they have to try to find very specialized care like me.
Dr. Sharp says as a team, they treat patients and learn along the way.
So what I'm trying to do for all of these physicians and for all these people is to deepen their understanding of child psychiatry to at least a level that they can have maybe 2 or 3 more extra tools in their pocket. But what we see over time is that mental health concerns continue to rise, continue to be more problematic, and continue to be more socially acceptable to talk about.
He says a big part of this is teamwork, as there's no shortage of need.
With OSU and combining with OU and try to work with all of the psychiatrists in town and try to get them all on the same page.
Sharp says it feels promising to carry out their mission to improve the quality of mental health and substance abuse in the state.
Health is common. Mental health is a big regulator of everything we do in our lives. And the more that we feel comfortable about it, the more that we can talk on it, the more that we can lean on each other, the less severity we will have.
Dr. Sharp says this really is a big milestone for comprehensive psychiatric services.